Have you ever stopped to think that you might have diabetes without even knowing it? Believe it or not, this is more common than you think. This quiet issue affects millions of people worldwide, and often the signs are right in front of us, but go unseen. Have you ever felt a strange thirst or endless tiredness that won't go away, even after resting? These are just two of the many signs that your body might be facing a bigger issue. The truth is, if diabetes isn't found in time, it can lead to big problems. And the worst part, it could be growing in you right now without you even knowing. What's even more shocking is that many diabetes signs are easily mixed up with other issues, causing thousands of people to live for years without knowing they have the illness. The aim of this video is to open your eyes to the 20 signs that you could have diabetes without even guessing it. And the best part? The sooner you spot these signs, the better your chances are of taking control and avoiding big problems later. Are you ready to see if you're part of this group? Let's jump into these signs and see what your body might be trying to show you. Before we begin, don't forget to follow the channel and turn on alerts so you don't miss any news. Also, tell us in the comments where you're watching from. We'd love to know. What causes diabetes? Diabetes happens due to problems in the body's making or use of insulin. In type 1 diabetes, the immune system attacks and destroys the beta cells in the pancreas, which make insulin needed to control blood sugar. The exact cause isn't clear, but genetic and outside factors, like viruses, can start the disease. In type 2 diabetes, the body becomes resistant to insulin or doesn't make enough of it. This type is often linked to being overweight, a lazy lifestyle, and genetic factors. Gestational diabetes happens during pregnancy due to hormone changes and insulin resistance, raising the risk of getting type 2 diabetes later. What are the consequences of not treating or making changes? If diabetes is not treated or properly managed, it can lead to serious and potentially fatal complications. Some of the main consequences include dental complications. Diabetes increases the risk of gum infections and tooth loss. Diabetic neuropathy. Nerve damage, especially in the legs and feet, resulting in pain, tingling, numbness, and even loss of sensation, increasing the risk of wounds and infections. Diabetic nephropathy. Kidney damage can lead to kidney failure, requiring dialysis or a kidney transplant. Cardiovascular diseases. Diabetes increases the risk of heart diseases, such as heart attacks and strokes, due to high blood sugar levels damaging blood vessels. Diabetic foot. Wounds and ulcers on the feet can occur due to poor circulation and neuropathy, potentially leading to amputation if not properly treated. Skin problems. Infections and healing difficulties are more common in people with diabetes. Diabetic retinopathy. Damage to the blood vessels in the eyes can lead to vision problems, including blindness. Pregnancy complications. Women with diabetes may face increased risks of complications during pregnancy, affecting both the health of the mother and the baby. These complications can be prevented or minimized, and at the end of this video, I'll show you how you can do that. What tests should I take to identify diabetes? Early diagnosis of diabetes can be done through blood tests that measure glucose levels. Fasting glucose tests, oral glucose tolerance tests, and hemoglobin A1C tests are some of the exams that can be done to diagnose diabetes. If you are diagnosed with diabetes, your doctor will recommend a treatment plan that may include lifestyle changes, medications, and regular monitoring of blood glucose levels. Now let's discuss in detail the 20 signs that may indicate the presence of diabetes. Stay until the end, because the 18th sign is something most people have, but few know about. Sign 1. Unexplained weight gain. Unexplained weight gain, especially in the abdominal area, can be a sign of type 2 diabetes. Insulin resistance can lead to fat accumulation in the abdomen, even if the person is following a healthy diet. This weight gain, often rapid and disproportionate, is an indication that the body is having trouble processing insulin properly, resulting in fat being stored in specific areas, such as the abdominal region. Sign 2. Fatigue. Fatigue is a common symptom in many health conditions, including diabetes. When the body can't use glucose properly, it doesn't have enough energy to function correctly, resulting in a constant feeling of tiredness. This happens because the body's cells are not receiving the necessary energy, leaving the person feeling exhausted even after a good night's sleep or adequate rest. Sign 3. Dry and itchy skin. Dry skin and itchiness can be symptoms of diabetes. Dehydration caused by frequent urination can lead to dry skin, and circulation problems can affect skin health, causing itching and infections. The lack of moisture in the skin, along with the body's difficulty in fighting infections, creates an environment prone to cracks, wounds, and even skin infections. Sign 4. Swollen gums. Swollen, red, and sensitive gums can be a sign of diabetes. Diabetes can weaken the body's ability to fight infections, making gum problems more likely. Gum inflammation or gingivitis is usually the first stage of periodontal disease, and poor blood sugar control can worsen these problems, leading to tooth loss in more advanced cases. Sign 5. Mood swings. Mood swings like irritability and unexplained mood changes can be a symptom of diabetes. Lack of energy and hormonal imbalances caused by diabetes can affect emotional well-being. Hyperglycemia, high blood glucose levels, can cause irritability, anxiety, and even depression. On the other hand, hypoglycemia, low blood glucose levels, can cause nervousness, confusion, agitation, and sudden mood swings. Sign 6. Bleeding gums. Bleeding gums can be a sign of diabetes. Elevated blood sugar levels can affect gum health, making them more susceptible to infections and bleeding. Bleeding can occur during brushing or flossing and is a sign of gingivitis, which, if untreated, can progress to periodontitis, a more serious condition that can lead to tooth loss. Sign 7. Excessive hunger. Excessive hunger, or polyphagia, is another common symptom of diabetes. When the body can't use glucose properly for energy, it sends signals to the brain indicating it needs more food, leading to a constant feeling of hunger, even after large meals. This happens because, despite food intake, glucose is not being properly processed to provide energy to the cells, leaving the body in a state of continuous hunger. Sign 8. Dark patches on the skin. Dark patches on the skin, especially in folds and creases like underarms and neck, can be a sign of insulin resistance, a precursor to type 2 diabetes. This condition is known as acanthosis nigricans and indicates high insulin levels in the body. These patches are typically dark, velvety, and thick, and may be uncomfortable or visually unappealing. While these patches don't cause symptoms beyond a change in appearance, they are an important sign that the body is struggling to regulate glucose levels. Sign 9. Frequent headaches. Frequent headaches can be a symptom of diabetes. High blood sugar levels can cause dehydration and changes in blood vessels, leading to headaches. Additionally, hypoglycemia, low blood glucose levels, can also trigger headaches, along with other symptoms like dizziness, confusion, and weakness, making it an important sign to watch out for. Sign 10. Frequent infections. Frequent infections, especially urinary and skin infections, can be a sign of diabetes. High blood sugar levels create an environment conducive to the growth of bacteria and fungi. The immune system, weakened by diabetes, has difficulty fighting these infections, which can become recurrent and harder to treat, requiring constant medical attention. Sign 11. Unexplained weight loss. Unexplained weight loss can be a sign of diabetes, particularly type 1 diabetes. When the body cannot get energy from glucose, it starts burning fat and muscle for energy, leading to rapid and unexpected weight loss. This process is particularly dangerous because it occurs even if the person is maintaining a normal diet or even increasing their food intake. Sign 12. Slow healing. Slow healing of cuts and wounds can be a sign of diabetes. High blood sugar levels can damage nerves and blood vessels, impairing blood flow and making healing more difficult. This increases the risk of infections and complications from simple wounds, especially in areas like the feet, where issues such as diabetic ulcers can develop, and in severe cases, lead to amputation. Sign 13. Frequent urination. The need to urinate frequently, or polyuria, is directly related to excessive thirst. The increased urine production is caused by excess glucose in the blood that the kidneys try to eliminate. This can be a major inconvenience, especially if you have to get up several times at night to go to the bathroom, which can disrupt your sleep and result in fatigue the next day. Sign 14. Oral infections. Oral infections, such as gingivitis and periodontitis, are more common in people with diabetes. High blood sugar levels can promote bacterial growth in the mouth, leading to gum and tooth infections. Oral health is often affected by diabetes because elevated glucose in the saliva creates a favorable environment for bacterial growth, increasing the risk of cavities and tooth loss. Sign 15. Tingling and numbness. Tingling and numbness in the hands and feet, also known as neuropathy, can be a sign of diabetes. High blood sugar levels can damage nerves over time, This can result in uncomfortable sensations of tingling, pain, or even loss of sensation in the extremities, increasing the risk of injury and infection without the person noticing. Sign 16. Dry mouth. Dry mouth, also known as xerostomia, can be a symptom of diabetes. Dehydration caused by frequent urination can result in insufficient saliva production, leading to a constant feeling of dry mouth. This can increase the risk of cavities, bad breath, and oral infections, as saliva plays a crucial role in the natural cleaning of the mouth. Sign 17. Difficulty concentrating. Difficulty concentrating can be a symptom of diabetes. Lack of energy and imbalances in blood sugar levels can affect brain function, resulting in difficulty concentrating and memory problems. This symptom is often reported by people with poorly controlled diabetes and can seriously affect performance at work or school. Sign 18. Blurred vision. Blurred vision is a common symptom of diabetes. High blood sugar levels can cause swelling in the lenses of the eyes, affecting the ability to focus. If untreated, blurred vision can lead to more serious complications, such as diabetic retinopathy, which can cause permanent blindness. Sign 19. Excessive thirst. One of the most common signs of diabetes is excessive thirst, also known as polydipsia. When blood sugar levels are elevated, the kidneys work harder to filter and absorb the excess glucose. When the kidneys can't keep up, the excess glucose is excreted in urine, leading to fluid loss and dehydration. This makes the person feel constantly thirsty, even when drinking large amounts of water. This cycle of thirst and urination can be exhausting and harmful, especially at night, affecting sleep quality. Sign 20. Nausea and vomiting. Frequent nausea and vomiting can be a sign of diabetes, especially when associated with other symptoms like excessive thirst and frequent urination. These symptoms can be caused by high blood glucose levels and diabetic ketoacidosis, a serious complication of diabetes that requires immediate treatment. How to avoid diabetes? These are the 20 signs that may indicate you have diabetes without knowing it. If you identify one or more of these symptoms, it's crucial to see a doctor for a complete evaluation. Remember, early detection can make all the difference in treating diabetes. Taking care of your health is essential for a long and healthy life. What is the treatment? Besides lifestyle changes, the treatment of diabetes can include the use of oral medications or insulin. There are various types of diabetes medications that work in different ways to help control blood glucose levels. Insulin is usually necessary for people with type 1 diabetes and may be needed for some people with type 2 diabetes. Regular monitoring of blood glucose levels is a crucial part of diabetes management. This can be done with a home glucose monitor, allowing you to measure your glucose levels several times a day. Keeping a record of glucose levels can help identify patterns and adjust treatment as necessary. Important recommendations. Diabetes complications can include cardiovascular diseases, nerve damage, neuropathy, kidney problems, nephropathy, eye problems, retinopathy, and foot problems. These complications can be serious and debilitating, but they can be prevented or delayed with proper diabetes management. Diabetes education is an important part of treatment. Participating in diabetes education programs can help you learn more about the condition, how to manage it effectively, and how to make healthy lifestyle choices. Emotional support is also important for people with diabetes, and support from family, friends, or support groups can be valuable. If you've been diagnosed with diabetes, it's important to follow the recommended treatment plan and make lifestyle changes to manage the condition. This may include a healthy diet, regular exercise, monitoring glucose levels, taking medications as prescribed, and attending regular medical checkups. Remember, diabetes is a manageable condition, and many people with diabetes live long and healthy lives with proper treatment. If you're concerned about diabetes symptoms, don't hesitate to see a doctor for a full evaluation. Early detection and proper treatment are essential for preventing complications and improving quality of life. If you have anything to add, please share it with us in the comments. Don't forget to subscribe to the channel. I'm leaving 2 videos on the screen that I'm sure you'll love.